Welcome back to County Board Wrap-Up. I'm your host, Kara O'Donnell, and with me today are Board Chair Libby Garvey and Board Member Katie Crystal to talk about those key actions the board took in April and what those actions mean for you and your community. Of course, the coronavirus remains at the top of everyone's mind and is the focus of much of the county's efforts and resources as we head into yet another month of stay at home in Arlington. As you can see, the board moved to all virtual meetings in April and made some other changes as well to keep government functioning in a transparent, inclusive, and accountable way, while at the same time keeping people safe and communicating the essential information on the pandemic. Libby, let's start with you. What are some of the highlights that the county's been taking? What are some of the biggest changes you've seen, and what are some of the ways I think we've been able to pivot really well?
Well, there have been a lot of changes like what we're doing here. And I think we're pivoting pretty well, considering the change. I think in many ways for us, the biggest challenge is communication with people. People are at home. This is new to all of us. We're trying, what's going on? What do we know? What's closed? What's open? What can I do? It makes it really hard. And we have a web page and put that up really quickly. And I think a lot of us noticed it was more information every day. I mean, the things are changing hourly. So while more and more information went up, it got to be kind of confusing to sort of thread through it. We were putting a lot of information up there, but then it got to be so much it was hard to actually deal with. So we just recently streamlined that page. And obviously we'll talk a bit about, what we're doing to make sure that people have enough to eat. That is a major issue for us, and try to make sure that our small businesses survive. And try to make sure that people stay as healthy as possible. It's a health emergency. It's an economic emergency. But for us, one of the major challenges is the communications, I think. And this is an effort, the way we're doing this today. We're holding town halls every Friday. 2 board members and some staff invite people to tune in. It's Facebook Live on Fridays at noon. But we also are welcoming people to let us know, how is this working for you? What can we do better? We're trying to get comment at public meetings. And so it's, I've been doing this job a long time, and this is totally new to me. Katie, what are you seeing?
Well, I think one of the things that's been challenging with the adapting is that, people all across Arlington, Virginia, and the nation are learning how to do their business online via video chat and video conferencing. It's not quite as easy for the county board or the commissions that advise us to just hop on a Zoom call, both because transparency is important to us and because it's the law. Anytime we are gathering, there needs to be an opportunity for public participation, which is to say viewing the meeting, preferably giving comments, to have it streaming, to have it captioned, and all other necessary steps to be fully transparent and inclusive. So I just want to commend our staff, particularly our clerk and our county board office staff and the ATV staff for their diligent work in trying to make sure that all of those meetings are broadcast as we try to adapt so that we can really hew to the spirit of that value of transparency and doing the public's work in public. Every time you see the 4 board members on the screen, there are about 15 more people on that call, making sure that it's available, broadcast, and accessible. So that's been one of the most interesting things in terms of adapting the work of the county board. Yeah. But I think Libby highlighted it beautifully when she talked about some of our most key needs and food access being at the very top of that priority list, along with reliable housing.
Yeah, you mentioned, we'll talk about that. I was just going to say, I want to compliment our DTS too, Department of Technology Services. We have done some upgrades just kind of before this all hit, and so grateful that we had done that. And I will just say on the legal part, it's so fascinating to see. So we're dealing with FOIA, Freedom of Information Act, and Virginia Code on meetings. Some of this code's been on the books for like 100 years or more. Certainly in the last 50, when nobody knew about technology, nobody knew about a pandemic, And so the law has been so, I don't know if you found that a bit, Katie, just kind of clunky and difficult to work with. We've got to do our work in this situation that law didn't envision. So that's been one of the challenges to manage all
That's
this.
a great point. The only thing I'd note is that they did know about a pandemic about 108 years ago.
Yes.
You're
Yes.
absolutely right. The law really didn't envision the ability for continuity of operations in a situation like this one. We're so fortunate to have the technology, but I think you're exactly right that the code hasn't necessarily kept up with that.
Yeah.
Right.
A lot of
And
changes.
who could have possibly imagined we'd be in this kind of situation for especially the length of time that we've been doing it so far? I think, doesn't this start month 3 next week? I don't know. I've lost all track of time.
Yeah.
But Libby, you did mention the dashboard on the county's website, and as you mentioned, there is a wealth of information on there. If anyone who might be watching hasn't experienced that dashboard as of yet, what are some of the highlights? What is the key information that is available to our residents right at their fingertips?
Well, it's key. One of the nice things about, I think it's always been there at your fingertips, but not so much to your eyes. And now it's much more visual. So there's information if you're having issues with getting food. And that's the gamut from people who they have plenty of resources, but they need to quarantine at home, or they're vulnerable to getting this disease. They really need to stay in their homes, and delivery services are sometimes having trouble. How do you get food to yourself? Then you've got all the way to people who had jobs, were always living on the edge, and now those jobs are gone and they don't have the money to get the food. And sometimes not an internet connection. So sometimes we depend on people to know what's going on to pass on the word. But anyway, food, business assistance, same thing. And you can just look at the pictures and click on it. What's open? What's safe to do? How do I get a mask? How do I make a mask? Basically, I think pretty much anything that you want to know is there. And in fact, if anybody listening finds they go on and they can't find what they need, send us an email, countyboard@arlingtonva.us, and tell us what you're trying to find and can't find. But there's a search bar. It should all be there. And we are continuing to work really hard to keep it up to date. So, Katie, anything you want to add?
No, just that I would really lift up something you were just sharing, Libby, about the desire to reach out to people who are maybe not English speakers, or for whom the web is not a reliable point of access for them. And so really just want to highlight both that a lot of our materials have been translated into Spanish. There are also materials on really basic and core information, like steps to protect your own health and safety, where to reach out for help in languages beyond Spanish, including Arabic and Vietnamese and others. It's also a little clunky, but we do have a Google Translate function on every page within that COVID-19 website for people to translate into, I think it's 9 or 11 different languages as well. We also have, hopefully everybody watching this has received it. The team has sent a mailer to every household in Arlington in both English and Spanish with really key public health information, personal health information, tenant information for those concerned about housing, and details about food. So we're really trying to make sure that this communication strategy is comprehensive. The website is a truly extraordinary resource. I would really encourage everyone to spend a little time there. And we're also working to extend that reach.
Yep. And then while we're at it, talk about, in case somebody's watching this and doesn't have easy access, phone numbers. Old technology, it works still. So the 228 1300, so 703-228-1300. If you're having issues or know somebody having issues with housing, with getting food, that's our Department of Human Services, and that will get you help. And then if you've just got questions about COVID, you're feeling sick, you're not sure what to do, somebody else seems to be sick, what's happening, there's a 7999 number, 228-7999, and you can call that. We're actually even looking at putting signs in the medians in the roadways for people to see in Spanish and English, because sometimes the mail, there are just so many different ways of getting information out, and we're really trying to use them all. Yeah.